Welcome this evening to our information webinar on MSc in Health Systems Management. To introduce the speakers today, with me here is Suzanne Keeley.
Hi, how are you? I'm looking forward to talking to you later in the presentation.
And also on the phone joining us in a little while will be Brian Egan, who's actually a current student on this program. And my name is Tilo Kroll. I'm the program director here at UCD School of Nursing, Midwifery and Health Systems, and we'll start with a brief introduction initially about this, the next probably 25-30 minutes about the program and a little bit about the background. Just to give you an overview of the presentation, I will first of all just give you a bit of detail about why we're doing this webinar. And the fact that it's going to be recorded as well. Then I will introduce health systems, the background for the need for studying health systems or going into health systems, and then more specifically, I will provide some details about the program itself and health systems management. But just start with this format of webinars, we've chosen really to reach out very broadly to people in and around Ireland primarily. Our program on MSc Health Systems Management, while technically in principle open to everyone, is primarily bound or focuses on the Irish healthcare context and Irish healthcare system. So we thought it's time actually to maybe run this information webinar to give you a little bit more detail about who is it for, why are we running this, what its purpose is. So just to give you another characterization of health systems from the WHO Europe, health systems are responsible for delivering services that improve, maintain, or restore the health of individuals and their communities. And I think the latter is probably quite important. Often we're just thinking about individual patient care and individual interventions, but health systems has really a focus that goes beyond the individual, in a particular intervention context, to a wider system that connects hospitals to communities, individuals within communities, and different professions. This includes the care provided by family doctors in addition to hospitals, but also health systems addresses less visible tasks such as the prevention and control of communicable disease, health promotion issues, health workforce planning issues, as well as generally an improvement of the social, economic, and environmental conditions of the context and the settings where people live. At the core of current health systems thinking and working are the building blocks, which I found in the WHO Health Systems Framework. They seek to address particular outcomes that are displayed here on the right-hand side, very much about improving efficiencies in existing healthcare delivery systems, protecting against social financial risk, improving the quality and level and equity of healthcare and health services, and ultimately health outcomes, and being very responsive and flexible in their approaches to delivering healthcare. So very much a dynamic, responsive system. And we see the different building blocks on the left-hand side that seek to achieve this while affecting safety, quality, coverage, and access. So very much related to how we deliver services, what kind of leadership and governance arrangements we find in the healthcare system, how it's being financed, what healthcare products, including vaccines and technologies we're delivering, what the composition and training of our health workforce looks like, and how information flows through the system and how we communicate with each other. So why focusing on healthcare system issues or health systems issues at UCD? The School of Nursing, Midwifery and Health Systems, as it is already reflected in the name, has a tradition of focusing not only on particular professional groups and their training, but also on the system-wide components. We've had health systems in the title of the school for a number of years, and we're now through the program, which is one of the first in Ireland, a leader in health systems research as well as in education. What makes us strong is also the formalized collaborative relationship with the Ireland East Hospital Group, which is the largest hospital group in Ireland. And we have, beyond that, strong partnerships with major health systems providers and researchers in Europe and worldwide. Our curriculum and the faculty working on this curriculum is very much interdisciplinary. We have health professionals with nursing, midwifery backgrounds. We have people with a medical background. We have sociologists, social scientists, psychologists, economists, and so on. And I think we need this multidisciplinary and interdisciplinary background to address the complexities of the issues that I just briefly talked about. Now, the MSc in Health Systems Management has particular aims, and there are 6 particular ones that I would like to highlight today. First of all, we've developed this program, this course, to enhance an understanding of the health policy, health financing, and healthcare delivery models that are found nationally here in Ireland, historically and currently, and perhaps in the future, but also beyond Ireland, internationally. We want to promote systems thinking, as it is in the name, and organizational change understanding, and create an appreciation for the complex relationships and interactions between the various elements that form our health systems. We also want to introduce, as part of this program, key concepts of evidence-informed design and comparative analysis related to the models, how we deliver healthcare and how we promote population health and well-being as a whole. Going back to the building blocks of the WHO framework that you've seen, leadership and knowledge mobilization or communication among the different stakeholders is quite essential in complex care environments and increasingly complex care environments, where we also have a need to connect communities with inpatient environments. We also want to foster critical reflection and analysis in the management of complex health systems challenges, both within the hospital and community context. So really to think about what we're doing, how we're doing things, and how we can improve services and delivery models. And we want to be creative and innovative in our approaches, as well as inclusive, and also think of the marginalized groups in our current healthcare systems and finding ways of how we include them in the service delivery, design, and processes, as well as in the evaluation of these processes. So questions: what works for whom and how? Why does it work? How can we replicate this, scale interventions and processes up so that they become sustainable in various settings and environments? And how can we influence policies are at the heart of this program. Now, let me talk a little bit about the program outline that we've put together. So the MSc Health Systems Management is a 2-year program. It's delivered on a part-time basis and amounts to 90 CTs credits. It's a level 9 postgraduate program. And the start is September 2017. And the fees approximately are 6,240 per year. These are subject to changes that might occur over time from year-to-year basis. So just to give you a brief overview of the 2 years, what they look like. In year 1, 50 ECTS credits are applied, and we basically have created this program in a modular fashion, which allows maximum flexibility and adaptability if you're interested in choosing and joining this program. It's a mix and match approach that's very much bespoke and tailored to individual needs and also organizational needs. In semester 1 of year 1, we're teaching on leadership and organizational dynamics, on budgeting and financing in healthcare, health policy and health systems introduction as a whole. These are courses that involve didactic teaching, but also a lot of group discussions, interaction, and we're very much interested in engaging in a critical and reflective dialogue with all our students right from day one, and learning about the diverse and interesting environments that they're engaged in. So we very much see this as an active process of involving everyone into these discussions of how the local systems play out and link to the more national, international systems. In semester 2, we're focusing, and then we're introducing the first choices in this program. We're focusing on information systems and security, so IT systems, which also involves electronic records, reflecting on how we're dealing and protecting electronic records, patient records, data in particular settings, or alternatively, focusing on clinical governance. So there's a choice element. The second choice element is between health economics or the management in action. Now, year 2 offers again more choice, and we have 2 pathways that we're introducing in year 2, allowing for 40 ECTS. So in total, it's a 90 credit program. So in year 2, with 40 ECTS with 2 pathways. Here we see first pathway 1, again broken down by semester 1 and semester 2. And we see the option in semester 1, health policy and systems research, so the introduction in particular of specific research methods, but also policy analysis elements in the semester, and the combination with either an empirical study or action research and implementation science and research and change. In semester 2, if the choice has been made in terms of an empirical study, this will continue in semester 2. If the route through action research and implementation science and research and change has been chosen, the action research component continues in semester 2. Now, this was the first pathway. The second pathway option, remember, year 1 stays the same, but we're talking about year 2 and in this pathway. The second pathway option offers in semester 1 quality and patient safety and outcomes, and here's the choice, a year-long empirical study, just like under the first pathway option, or alternatively, again, action research and implementation science and research and change. In semester 2, the combination between management and action, optional, and a year-long empirical study or action research. So I should clarify this for this, the optional component is that here the quality and patient safety outcome would run either in semester 1, so that's optional, or individuals take the management and action in semester 2. So what are the benefits of taking this program? I talked a lot about the background for it and the need for it. So we hope that successful students will have an enhanced insight into the system complexities, improved skill set to diagnose and tackle complex challenges wherever they work, and whatever these challenges might be. They have an appreciation for different leadership and managerial roles and styles, and they have greater confidence in the skills portfolio in relation to also adopting senior strategic and leadership roles in the healthcare system. But it's also a pathway, a potential route into a future academic career. For instance, also through UCD, here in our school, the School of Nursing, Midwifery and Health Systems, we offer an MSc by research or a PhD by publication, which is another option to continue whatever is being learned and started as part of this program. So without further delay now, I would like to hand over to Suzanne to give you a little more insights about how you will go about applying to the program. So,
okay.
So
Thanks, Thela. That was really interesting to hear the background about the program and what it'll be involved in studying. I'm going to talk you a little bit through how you would apply for the program. We have our own online application system here in UCD, and if you wish to apply for this program, as Thela has described, you'll need to go to ucd.ie/apply and click on the Apply to UCD button so you can see it highlighted there in red. Then you'll need to find the course or start a new course application. So if you see there's a link there to click on to start a new course application. And that takes you through to the portal here where you're going to either create a new account if you haven't been a UCD student or applied online with UCD before, or you're going to use your existing account. So then you're going to need to find the course that you want to apply for, which will hopefully be the MSc in Health Systems Management. That is, so if you look at there in the course finder, there's a filter options box on the left, and the major code is X722. So you need to search for that and then click on apply. It'll pop up there on the bottom of the screen, and you'll also see that the title of the program, the MSc in Health Systems Management, is highlighted in blue, and you can click on that link for more information on the program as well. So in terms of applying, you need to complete your application form online, which involves putting together all your personal details, your academic record so far, and completing details of your employment history, and uploading support documentation such as the academic transcripts. If you're a UCD student, you'll have we will have access to your UCD student record from your previous time here, so you don't need to upload that. But for students from all of the universities, you'll need to forward us your transcripts. You'll also need to give us documentation to prove your identity, so there's usually a photocopy of a birth cert involved or a passport as well. And then it's important to make sure that you click submit. You don't need to complete your application all in one go. You can commence your application and you can come back to it over a course of a few days or weeks, because sometimes we appreciate that it can take time to put all this information together. So you'll receive an email confirming your application has been received, and then the application will be processed here by our admissions team and by the academic director of the program as well. And you'll be able to track the application progress by logging back into your account, so you can see that it'll be submitted, you'll see when a decision is made, and you'll receive an email then when a decision is made, and hopefully giving you details of your offer. If you have any questions about this, you can contact Bernadette Manley, and her email address is here below, and Bernadette is the program administrator for the MSc in Health Systems Management. We would ask you to make sure that you've submitted all documentation to us by the deadline of the 15th of August this year. This enables us to make decisions about the programs and to ensure that we have sufficient numbers for all the programs to run. And it also means that students will have time to have their registration completed when the program starts in early September. So why would you like to become a UCD student? There's lots of advantages to being a UCD student. And even as a part-time student, you will have full student life. You'll receive a U card, which is your student card, an identity card, which gives you access to our library. It gives you access to the UCD Sports and Fitness Centre. You can see the lovely photos of that down there at the bottom of the screen. And you also have a full range of IT support, which is really important as you're going through the programme. You'll also have access to the UCD Career Development Centre, which is based here on the Belfield campus. And of course, you'll get student discounts with your U card in many shops around town.
So yeah, if you've seen, there's a great program offering, but also beyond actually the nature of the program itself, great opportunities on campus and for future development. So I think it's great that we have Brian online, who's actually joined us tonight to give us a little bit about his insights and his experiences with being on the program for the last 2 years. And so, Brian, are you there?
Hi Thilo, how are you? Thanks for inviting me to contribute to today's webinar.
Thank you very much. Thanks for joining us, listening in. So I think future students, when you put yourself back maybe a couple of years, when you considered applying for this program, what do you think were the main drivers for you? What interested you in this program, and what was the decisive moment to go for it?
Well, I think like a lot of people, Thilo, my undergraduate degree was in quite a broad course. It was in public administration, so I didn't particularly focus on any one industry as such. I've been working in the healthcare industry for about 5 years now, predominantly with regards health insurance and hospital finance. And over the last couple of years, I guess I was anxious to I suppose build my skill set further in a particular direction. I felt that I wanted to pursue a career in hospital management as such, and the course on offer in UCD seemed to tick the majority of the boxes I was looking for, and also give my organisation or the hospital that I worked in an opportunity to, I suppose, invest in a leadership programme that would ultimately benefit them as well.
That's excellent. Thank you. I'm just being handed here some notes. What kind of career opportunities do you think are open for yourself and maybe other students, if you've spoken to colleagues, that who have taken the program? What do you think? What might be the pathways that you said? This kind of you went into it with an idea of making a change in your career trajectory. And about maybe perhaps yourself, but also if you've spoken to fellow students, have they spoken to you or given you some insights of what it might enable you to do with this program?
Well, I think there was a shared desire to I suppose, for students to help change the direction of the Irish healthcare system as such. I would have picked up from fellow students of mine that they were anxious to be change agents in their own organisation first and foremost, but they felt they needed to develop their own skill set and I suppose learn more about other departments and how health systems work in a broad sense before they could go back to their own organisation and I suppose channel that change that they were looking to pursue. I suppose the course in itself, it focuses, there's a number of modules on management and there's modules on finance. And there's a module on leadership as well. So I guess on completion of the course and when you return back to your own workplace, you do come back far more equipped than when you started in terms of what you've learned. And I do think that organisations and health organisations in Ireland in particular are looking for students or looking for people who have that type of education backing them up as well. And I think that was a key driver to certainly myself and indeed my fellow students as well.
That's very interesting, Brian. And I think what you mentioned there a moment ago about seeing yourself as a change agent, I think that requires, I guess, first of all, the confidence of seeing yourself in that particular role, but then also combined with that, having the tools and the skills to affect change wherever you are and work within an organization. Whether it's a senior managerial role or in intermediate managerial roles. So I think you summarized that very well for us. Is there, if you had any advice for students who were joining or considering joining this program, what would be your top advice? Maybe if you think back those 2 years prior to starting. If they were grappling with the question, should I not? What would be your advice be in terms of what to find out, what to think about, what to do in the first maybe few days of engaging with the program?
Well, I think if prospective students are, I would approach it with an open mind in that the course offers, I suppose, a wide range of modules to help your education, but my advice probably would be to approach it with an open mind. The course looks at international healthcare systems, for example, So you do, I suppose, there's lots of unplanned learning or learning that you wouldn't expect. You look at examples where, for example, in Cuba, where I wouldn't have necessarily have known about the healthcare system in Cuba, and I suppose it gives you the opportunity to, excuse me. Sorry, that's, I think, am I cut off there, Tito? One sec.
We have you. Yep. Hello?
Hello? Sorry about that. Apologies.
No problem, we can hear you.
No, but I think the best advice is that it's not, I suppose, the course doesn't particularly focus on just one area of health systems. It develops you personally as well. A lot of time is put into group sessions and discussion and debate. So it's not just about the, I suppose, the modules themselves. You're challenged as an individual and as a professional, and I think you develop yourself in that regard as well. So my advice would be to approach the course in an open mind and be wary of the fact that you're likely to learn not only about health systems and how they work internationally, but you're likely to develop professionally yourself as well, and learn skills like how to present, for example, how to hold debate, and how to critique reports and real life examples. So that would be my advice, I think, on that, Thilo.
Thank you. That's very helpful. I think we probably let you go into your well-deserved evening, Brian, and but we remain on the line. We are remaining on the line here just to answer any potential questions that people may have. So one question is, how are students assessed on the program? I think this is pretty much a broad question. There are a variety of ways of assessing, and that's pretty much linked to individual modules. So these include written assessments or assignments that people or the students are asked to complete. There's we've seen in the outline, it's some the dissertation component which will be assessed, which is a longer piece of writing, but very much also the interactive elements of engaging in critical discussions in group presentations, and in producing a poster summarizing findings of an improvement project. All those are different elements that enter the assessment.
Absolutely, and I think there's a lot about, as Brian said, developing yourself, and there's leading seminars and, as I said, the group presentation. So it's a lot of it is designed about yourself as well, and bringing yourself along as well. Yeah.
And it's I mean, over the 2 years, there's a breadth of different assessment ways, but also development opportunities. Time commitments, and how often do I need to be on campus?
Okay, so a lot of the modules would be delivered on Mondays, and our semesters are 12 weeks long. So in semester 1, there's 12 weeks, and I think you'll be in for most, if not all, of those 12 weeks in semester 1, and similarly in semester 2. In year 2, because of your working on your dissertation and the action research project, then attendance on campus would be less frequent. But I suppose you're still working very hard on the work, the coursework in the background.
And it's important to note also, when you're working on the dissertation, that you have a designated supervisor, and you're encouraged really to get in touch, stay in touch with the supervisor, provide regular updates of where you are. And I think that's it's not to just monitor progress, but it's also to be there to be a help and assistance to you as you go through the different stages of writing and preparing this dissertation, and the empirical work that underpins it, or the action research work that goes into that. So I think it's very advisable to stay in close contact.
Yes,
with
definitely for the whole study, for the full 2 years. Yeah.
Yeah. Any further questions? No. When we're looking around here in the room, then that means just we have a few people that we actually would like to acknowledge and thank, because they have done a bulk of the work and continue to do a bulk of the work in the background. Maria Flanagan, who's the postgraduate relations manager, is a great resource. Bernadette Manley, who is really sort of the heart and soul of administering the applications, answering all brilliant questions, and you've seen the email address earlier, and Justin Dawson, who's juggling all sorts of technological queries and opportunities. So we have
just some, I suppose, some final contact details if there are any more questions. As Thilo's given Bernadette a glowing recommendation there. Bernadette is absolutely the mine of all information on the programme. So if you have any general queries, Bernadette will talk you through them. And you've met Thilo here today as well. So Thilo is the academic who's in charge of the programme. He's the programme director. So if you have any queries from an academic perspective, Thilo would be the person. And I think Justin had just showed us one more question there.
Yep. The question was whether you have to work in a healthcare setting to be part of the program. Well, this is a very good question, and a question I would say we take up on an individual basis. I think you pretty much have to. I mean, the Irish healthcare system is a health and social care system, and I think one entry requirement is that you have some managerial responsibility, and health systems is in the title. So I think links with improving health and well-being would be important. Let's say if you did not, if you were in a role that, say in a work environment that whether your role is about improving health and well-being, and you have a managerial role, then please speak to us. We'll definitely be interested in looking into the application. It's primarily geared towards the health and social care system, but I can envision scenarios and situations where you're not immediately tied to it. So just thinking of the care home environments as well, and that might be.
Can I ask you, Thilo, do you think it could be used for somebody who wishes to move into the healthcare or the health systems as a career option, so that if they're working in a managerial position and would like to use this to transition into working in a healthcare setting, do you think that would be something that would be considered?
I think we would have to look at the application, because I think there has to be enough of the similar context actually to do the empirical work, the dissertation, the action research work, and having those responsibilities at the moment. But I think I would look at that on a one-to-one basis and see, and maybe have a conversation, a direct face-to-face conversation or telephone conversation, if someone's thinking about a career change. I think if there are no further questions, I think we're probably just winding up our webinar today. And thanks to everyone who has been involved and who's dialed in, joined in the discussion. And also thanks to you, Suzanne, for being here. Thank you. And thanks for watching. And please contact us if you have any further queries, and get in touch.
Goodbye.
Thank you.
Thanks.